All right, so the first bandage that we are going to demonstrate today is called a RobertJones bandage. So the function of a RobertJones bandage is going to, for the most part, be stabilization, protection of the limb, and provide enough motion within that bandage for swelling that may happen. So with this type of bandage, it's very different than all the others that we're going to do because we use a material called rolled cotton. So let me see that rolled cotton there. Okay, so the rolled cotton that we use is this material. So looks like a fluffy cloud, okay? So the way we get to this material is it comes in a package that looks like so. And in this package, it's a longer strip. So what we're gonna do is we're actually gonna cut this cotton in half. So if we take this stuff out of the package, then we are going to see material that looks like this, okay? So we're gonna have material that's wrapped in this blue strip of paper. So what we're gonna do first is we're going to cut this cotton in half. So if we lay it on the table and start pulling out the strip of paper, then we're gonna get to the cotton roll. And I'm actually going to spin it around for you guys. So we have the cotton roll, and as we unroll it, the cotton roll here, you start rolling on itself. So as you get about 3 or 4 rolls in it, then you can actually come right in the center and tear that cotton in half. Then you lay it back down on the table and tightly roll the cotton again on itself 3 or 4 times and then tear it. And we go for the entire length of rolling the cotton, and you want to kind of push together towards the center, because if not, then it will look like one of those suckers where it gets long on the outside, and you don't want that. So we push it towards the center and tear it apart. So push it to the center and tear it apart for the entire length, and then that'll give us 2 even rolls of cotton, because if you leave it at this long length, you cannot get it as tight as you want to get it to put it on the dog's leg. Now, we use this rolled cotton. Okay, so we use this type of rolled cotton for a medium to large breed dog. Okay, so this RobertJones bandage using this rolled cotton would be specifically for a medium to large or giant breed dog. If you have a small breed dog, then instead of this, we're going to use our standard gauze or rolled gauze that we have here. It's called cast padding. So because a dog is so small, you would just bury your dog with this material. So a small breed or toy breed dog is going to use cast padding instead, okay? So to place this bandage, before we put our first layer on, the primary layer, we have to add tape stirrups. And the function of the tape stirrups is going to be, give me another one. The function of the tape stirrups here is so the bandage doesn't slip. If you forget these, the bandage will slip off within a matter of a couple hours. So standard placement of these tape stirrups is medial and lateral on the limb. And then what we do is when you stick it onto the dog, okay, you can do one of 2 things. You can put a popsicle stick in between these 2 sticky strips of tape, or what I do is just fold up the end of the tape so that it has an edge to it, and then when you stick them together, you can grab that non-sticky edge and pull it apart. So we have the tape on here, and then you have an assistant that's going to come in and hold the leg in a nice straight fashion. So with the RobertJones, you want your leg to be straight. And with the RobertJones, you are placing this because you have trauma or a fracture that is below the elbow, okay? With the bandage, you have to stabilize the joint above and the joint below that trauma. So this bandage is only placed on an injury, such as a fracture, that is below the elbow joint, okay? So the primary layer is going to be our bulky layer that we have. And that bulky layer, okay, is what's going to provide all the compression, but also the give if there's tissue swelling, and it's going to provide the protection and stabilization to that limb. So when you start your bandage, you go all the way to the tip of the toes, where you just have the very tip of the toenails sticking out of the end of the bandage. And when you roll your bandage on, the bandage needs to roll flat to the dog. So when you're looking at the roll of cotton, you notice that the roll is flat here, whereas if I roll it out, it's on the dog flat. If I flip this over and I try and roll it out, I have a gap here, a little triangle, and I can't get that bandage as flat and tight as I want. So you always have to have the bandage positioned so that it's flat on the dog. So we go to the tip of the toes, and your goal with this is to pull this cotton as tight as you can before you tear it. And then as you're starting to go up the limb, you kind of take a 30 to 45 degree angle so that you can maintain that nice straight tightness, okay, and have a 50% overlap with the previous layer that you did. So you see about a 50% overlap in that layer. If you go straight, then you bulk your bandage too much in one spot. So you keep it to where you go on that 50% overlap all the way up the limb, above the elbow. So basically on a forelimb, you're going all the way into that axillary region as far as you can go. And then when you get to that point, you can just tear your material. It tears really easily, okay? Then you're gonna take your next roll and start again. The other thing you're gonna make sure you're doing at this point is your assistant's holding that tape nice and tight so you don't twist the toes, because you can find out that you've twisted the toes and the toes are 90 degrees in a different direction because the dog had a fracture. So you make sure you keep that leg nice and straight. This bandage is going to be the most bulky bandage that you perform, and there's a reason for that. That's how you get the compression and the stabilization that you need and the support when you have swelling, either post-operatively, immediately after a surgery, or dealing with a fracture that's waiting to go to surgery. Those are going to be your two most common scenarios that you place this bandage: immediate post-operatively, or if you're waiting to go to surgery. So we're going to do, and I have some pre-torn pieces here, so you guys didn't have to watch me go through that process again. So we're going to do one more of these, and I think that'll be good enough. And you notice that I'm just pulling this cotton really tight as I'm wrapping it around that leg, because you cannot pull it too tight. I'll show you what happens if you pull it too tight. Okay, if I pull it too tight, I can tear it right away. So basically, you're getting it as tight as you can without tearing it. Okay, now once you kind of get this, I'm going to put a little bit more down here because you want it very even in your bulkiness. So if you only go part of the way up the leg, that's okay with this type of bandage, because I want it to be even everywhere. My goal is a nice solid tube that will thump like a watermelon when I'm done, okay? Now the next layer is our secondary layer, and it's what we call cling gauze. So it's a stretchy gauze that's thin. This is going to provide the compression that we need. It's going to suck down all this cotton. So our goal with this material is to pull it as tight as we can, because you will not get it too tight for this bandage. So again, we start at the tip of the toes, and I always leave just a little bit of that cotton, okay? You don't go past the cotton and cinch it in. You kind of go right at the edge of that cotton. And you pull it tight on the lateral aspect. While you're pulling tight, you wrap around the medial aspect. You're pulling tight again, and then wrap it up, okay? And then you pull tight on that lateral side, wrap it around the dog, pull it tight again here, kind of on the caudal lateral side, or caudal medial side, excuse me, and then wrap it up and around. So you can see how much it's cinching that bandage down by doing that, okay? So you pull it tight, kind of on two spots, on the back side and then over on the front side. And that's going to cinch that bandage down and give us that watermelon sound when we're done. And again, like I said, this rolled cotton, you can't get it too tight, so you don't have to worry about cinching it too tight. Whereas if when we do our other bandages, it's absolutely important that you don't follow this same protocol to this degree, because you will make your bandage too tight. And again, we're leaving a little bit, a 1/4 of an inch or so of that cast padding so we don't go past it, okay, on the limb. If I have extra gauze, I will often just go right back down the leg and cinch it again. So I don't waste it. Then when you get to a part here where you're done, then you can just find a flap and tuck it in. Okay, so now we have our first 2 layers, the primary and secondary layer on for the bandage. Now we need to do our tertiary layer, but before we do that, which is with this vet wrap, okay, we have to do a very important step that we often forget about, even I do this all the time, is you have to take the tape, okay, that we stuck together out at the tip of the toes, separate it apart. Okay, when you have your tape separated, so you have your medial piece, you turn it on itself and you put the sticky side down, okay, onto your bandage. Same thing with this medial piece, you turn it on itself and you put it up the leg so that it sticks to the bandage. Okay, these stirrups here are what keep this bandage from falling off and slipping, okay, within a matter of hours after placement. Now, the vet wrap is going to secure the tape on even further. So with the vet wrap, okay, if you notice what the vet wrap looks like, it's very tightly rolled, okay? It's got a lot of bubbles in it. With this bandage, you can stretch those bubbles out pretty good. You want to be cautious how much stretch you give in any other bandage, okay? This is the exception because this material cannot get squeezed down too tight. Now, if you have a small breed dog and you're using that cast padding as your primary layer instead of this rolled cotton, then you have to absolutely be cautious how much you're stretching this. And because of that, what you want to do is eliminate yourself from pulling on that vet wrap too much. So what we do is we actually unravel the entire vet wrap roll, okay? And then we roll it back on itself. And it doesn't have to be precise, but we just let it roll right back on itself so that you're not pulling on the vet wrap every time you're doing one of your passes around the limb. So you eliminate trying to cinch down and make that vet wrap too tight. Okay, so with your vet wrap re-rolled, you can see the difference now in the way we rolled it and then how it comes originally. So now we take that vet wrap, and again, you leave just a 1/4 of an inch or even a little less, just a little layer. And you, on this bandage, can pull that vet wrap a little bit tighter because we have the room to do that with a RobertJones bandage. As you're moving up the leg, again, 50% overlap. And I give, on this type of bandage, a little tug on the cranial side. And then as I wrap around, I'm tugging again and a little pressure on the caudal side and the medial side there. And so you're wrapping around the leg, but you're letting that wrap kind of just fall off of the roll. Okay, giving yourself 50% overlap. And you could see where I didn't unravel it at the very end here. I'm having to pull it apart, and that's cinching down that vet wrap every time. So if you have a small breed dog or you have a case where you're using cast padding for any different type of bandage, then you can run into some significant constriction complications. If you don't get all the way around, you can just pick up where you left off and then go around that limb. Okay, and sometimes I'll just go back 1 or 2 strips just to make sure I have good security of that layer, and then cut our vet wrap. So that is a modified RobertJones.